eClinicalWorks recently visited Coastal Medical Incorporated, a physician-owned, physician-governed medical organization located in Providence, Rhode Island. Coastal Medical employs 91 providers in 19 offices across the state, providing care for approximately 105,000 adult and pediatric patients. Coastal Medical's practices are certified by NCQA as patient-centered medical homes. As part of the PCMH Practice Transformation Initiative, Coastal Medical implemented the eClinicalWorks patient portal. Today, 35% of Coastal Medical's patient population, nearly 37,000 patients, are web-enabled and use the secure portal to stay connected to their providers and to manage their healthcare online. Coastal Medical was a 2012 recipient of the prestigious HIMSS Davies Award for Excellence in Technology Implementation in the ambulatory category. Among the many staff members we spoke with, Merrill Moss, Coastal Medical's Chief Operating Officer, Dr. Alan Kuros, President and CEO, and Dr. Stephen Kempner, Medical Director, Internal Medicine, shared their insights and experiences on Coastal Medical's growth, success, and continuing quest to deliver excellence in healthcare to their patients.
You know, I think that it was very apparent to us that we had to improve documentation and that the paper record was antiquated. I don't think that we had any idea of the possibilities or the opportunities that the EMR would have had afforded us.
We looked at the electronic medical record from the beginning as a clinical tool, which I think is perhaps different because many might look at it as a piece of technology. But for us, the EMR was a way to more carefully document the care we deliver. We use it as a tool to make sure that that care is more complete. And it also became the basis of measuring and reporting on quality.
We really looked at it strictly in 2006 as a documentation tool. We didn't think that it would change our business strategy. We didn't think it would change completely the way we care for patients. We really only thought of it in those terms, and it's become so much more than that.
I think it allows me to organize charts better. It allows me to recognize when patients have or have not had screening studies. It allows me to track laboratory results more easily. I can graph results when people have more than one test over a period of time, and showing that to the patient often is helpful to get them to follow what I'd like them to do in their treatments.
We went through a process like many others do, looking at multiple vendors. And I think that we felt that eClinicalWorks had the most flexibility. But not only that, as we looked at implementations of other vendors throughout the country, and we were very diligent, we found that they really struggled actually implementing it. So although the software might look fantastic and the reporting was very high quality, docs weren't using it. And what we found when we visited eClinicalWorks sites, that the implementation was much smoother, that the physicians were actually using it, and that the physicians felt that the EMR was very flexible.
What I like about the computer is that I like that everything is in one place and I don't have to go searching for test results or documents. I can look everything up. And I also like the e-prescribing. I think that's improved care a great deal.
The system is pretty efficient. It allows me to do a lot of things at just my fingertips. So now I'm going to facilitate a couple of prescriptions again to a facility for some compression stock-ins, and I can facilitate that right through the computer system without having to pick up the phone, dial anybody, talk to anybody. It's a pretty efficient system, and it's easy for me.
It helps us with patient care. We get results from the lab the same day, x-rays as well. It's very helpful, the patients like it.
Well, one of the nice things, of course, is that people can contact us from anywhere in the country now. And if they have a need, we can have all their information available to someone. So I have had people who have been in other hospitals in other states calling me sometimes in the evening or on weekends. I can provide all the information that's available in the electronic record. We can fax that information directly from the record. I actually had a patient who was in Europe, I think it was in Ireland, and I actually faxed a copy of their EKG to the doctor in Ireland.
As part of the team here at Coastal, I run the pharmacy program. Our pharmacists are located in our primary care offices, and we meet with patients for a 45-minute patient visit to discuss medication, what we call medication therapy management. which is essentially a visit that we discuss all medications that a patient is taking, if they were prescribed by our providers or an outside physician. Our patients do really enjoy meeting with the pharmacist. They like the fact that they're able to sit with someone for 45 minutes to either discuss in great detail issues related to a disease state or their medications. We've done patient satisfaction surveys, and the feedback from them has been that they love meeting with us. They enjoy the time that we've taken to even write up a simple, what we feel might be a simple plan for them about when to take their medications and how to take it.
I think it's important to remember, as we think about transformation in the care delivery system, as we think about use of health information technology, as we think about payment reform, and all these things are very important, we still have to put the patient at the center. We have to remember that ultimately the goal here is to provide each individual patient with a better experience of care. We want to improve the health of individual patients and the population of patients that we're assuming responsibility for.
We firmly believe that the key to our success in the implementation of the record and the way that folks have learned is to have eClinicalWorks trainers on staff here, not eClinicalWorks trainers that come from eClinicalWorks, but our own staff who are mainly clinical and support the record.
We are in charge of the training at the offices. We manage the Meaningful Use Incentive Program here at Coastal. We also run an optimization committee so that we can determine ways to improve our use of the EHR. And also, as new features roll out from eClinicalWorks, it's difficult for small practices to really implement changes in the office and stay on top of researching new functionality. We take care of that here, and then we simplify it and work with the practices to get them on board.
By the end of this year, we believe that Coastal will have about 80% of our patients on shared savings models. Now that's where the ROI comes in, the return on investment. We said, let's look at every single cost that we can attribute to the electronic health record from the time we thought of it in 2005 until now. And we think that that's about $6 million. And that includes IT staff and trainers, our electronic health record trainers, all the hardware, all the software, all the maintenance costs, and our time, about $6 million. But enhanced fee-for-service, meaningful use, our shared savings contract, payment for quality targets, reductions in transcription, reductions in staff, and new groups joining us really accounts for about $17 million. So we've had, if you take the $6 million off, let's say $18 million, we're down to 12, we have had a 200% return on investment. In addition, what ECW has allowed us to do is not only to bill very, very well for coastal physicians, for example, our days in AR are 14 right now, but we also bill for physicians in the community, hospital systems, we bill for folks in Rhode Island, we bill for folks in Connecticut, and it's allowed us to grow this different business that we actually happen to do extremely well.
This year's HIMSS Ambulatory Davies Award goes to Coastal Medical.
Of course, as soon as you say the Davies Award, I have a big smile on my face.
We're very proud of the Davies Award, and really I think Coastal winning the Davies Award is really the result of a collaborative effort.
And we didn't really understand the extent of the work that had to be done, but we embraced it as we always embrace all the work that we do. And what they saw in us that was different from others, which was really so affirming, is that our physicians lead the way at Coastal.
I think the Davies Award came to us in part because of the unique way that we've looked at the electronic medical record and implemented the electronic medical record. Again, it is a clinical tool. It's a foundational piece of transforming the way that we want to deliver health care so that we can improve quality, so that we can improve the patient's experience of care, and so that we can make care more efficient. And you cannot deliver on those promises without health information technology.
Coastal Medical Incorporated and eClinicalWorks, improving healthcare together.